Science meets healthcare strategies. I'm A.A. Odie, and my co-hosts are.
I'm Melody.
Hi, I'm Stephanie.
Okay, and today we're unpacking how labs can build sustainable operations that align more with what we really are focused on, value-based care. Kind of why the most resilient labs are thinking kind of beyond today's test volumes.
That's right. And as a reminder, value-based models reward better outcomes. And value is defined as the improvement in outcomes for the money you spend.
That's right, over the full cycle of care. But labs are financially tied most often to fee-for-service and a volume-based approach. And so it's very transactional. But when we think about sustainability, we have to help labs pivot. Not only do the right tests at the right time with the least waste, but with the strongest data signal for downstream care decisions.
Yes, so clinical laboratories remain the most cost-effective, least invasive source of objective healthcare information in disease prevention, in diagnosis, improving outcomes, and fulfilling essential just public health surveillance. We can't be lab cares without knowing that and kind of applying that as we kind of move forward.
Right, and we can't talk about sustainability without talking about the future of diagnostics as well. We have an expanding portfolio of new therapeutics, companion diagnostics, and all these new biomarkers that are coming out all the time in the healthcare market, which really relies on laboratory scientists' expertise and an involvement of laboratorians in all aspects of development life cycles, including translational medicine, as we talked about before.
Yeah, and we don't want to forget about the future because the future does include AI, unified exposure, and recruitment, and the list goes on.
Okay, so let's break it down.
Let's do it. Lab care.
Energy, plastic, emotions, that's part of it. But in laboratory medicine, sustainability is broader. We'll work in 4 interlocking pillars today when we talk. So let's talk about operational, clinical, workforce, and new horizons. Break it down.
Let's break it down. I mean, Steph, you've got the most operational experience, financial experience. Do you want to kind of start there?
Ooh.
I want it back to you.
Well, thank you. Cue the flip of hair. If you're listening and you're working in a clinical laboratory in any type of leadership or non-leadership role, it's all of our responsibilities to be fiscally and fiduciarily, is that a word? We have a fiduciary responsibility to the organizations that we work for and the patients that we serve to make sure that we're using those resources correctly and making sure that we are contributing to the sustainability efforts, whether that's looking for ways to save money or looking for ways to preserve our time and our supplies. People don't often realize that labor is one of the highest costs that you have in any organization. So that's why controlling that labor and making sure that we are being as lean in our workflow processes and being as efficient with our time as possible is something that leaders are always looking at. So nobody is just making sure that they are breathing down your back or micromanaging you. It's all about making sure that we can sustain ourselves as an organization. And that's really where I live and breathe every single day, is making sure that I support people to make sure they have the tools and equipment they need to do their job, but also making sure that those tools and equipment are there for the entire laboratory and ultimately the entire organization. It's also important that we look at reimbursements for what we're doing, that we're properly getting paid for the things that we're doing, that we're getting prior authorization for the tests that we're sending out, so we can make sure that there is enough coming back in for everything that we might send out.
When we're looking at value-based payment models, they are very different. We're talking about that bundled model, potentially an incentive payment for having value-based laboratory practices. There's a lot of different things that go into that. And so I do think that it's going to look very different, and labs have to remain and be able to live in that environment. They have to be sustainable, essentially, is the word. But yeah, Aaron, what are your thoughts?
Yeah, no, I mean, I agree. It's we've got to have the people there for infrastructure wise. So if you're going to expand into your communities, you haven't listened to our equity episode, make sure you go back, because you got to go provide that care to your communities. If you're expanding your outreach practice, you have to have the people that, like Stephanie touched on, to expand your practices and sustain your practices. And you've got to make sure you're reaching those groups and those people. And then just infrastructure wise, I mean, if you don't have the service agreements in place and you don't have the contracts with the different payers, you can't really sustain your practice. So it is being aware of that reimbursement that Stephanie talked about.
Yeah, and I think from a clinical perspective, I mean, we run a lot of tests. We talk about overutilization and underutilization a lot. But there's more to it than that, right? Like, tests can change care based on the results. And are we eliminating low value, duplicative, or outdated assays, conserving reagent spend and clinician attention to data points that statistically really aren't going to matter? Are we supporting guidelines and best practice? You can listen to our other previous ones in lab care. It all rolls into each other, right? Sustainability is kind of the last part of the lab cares, but it's actually the part that encompasses everything that we're talking about, because you can't just be doing stuff to do stuff. We have to really be intentional and focus on what the impact to patient outcomes will be by the testing that we're taking on.
Yeah, I feel like.
Yeah, and
go ahead.
Sorry. I was going to say, if you need help with that, if you're working in a rural laboratory, or if you don't have colleagues that you can lean on, professional organizations always put out lists about different utilization tips and guidelines and some of the best practices kind of studied out there. So make sure that you're leaning into your laboratory communities if you need help with that.
Yeah.
I was just going to say, you're lucky if you have a DCLS on at the hospital. So Melody's constantly looking at sustainability, and from conversations we've had, that she's looking at, is the testing order the most relative? Is there a better test, which plays into sustainability, not just ordering a test to order it. So as the DCLS in the group, Melody, Dr. Nelson.
No, but I love that you highlight workforce, though, right? So let's talk about workforce sustainability. We've talked a little bit about financial and clinical sustainability, but from a workforce perspective, we all know where we are, right? So how do we do better about recruitment and burnout? I'm interested in your guys' thoughts. You do a lot in this space.
Yeah, when I think about recruitment and burnout and just our laboratory system, you kind of almost think of it like a funnel, right? You think of a funnel going into a bucket. And if you think about the picturesque of a funnel, you have people coming in from, biology backgrounds. You got people who come in through the traditional MLS or MLT route. And then you got people who are coming in through other routes. And we're all coming into this funnel, and you all end up in this bucket. But at the bottom of the bucket, there might be holes where people are linking out just because of ceilings, of toxic work environments, of burnout, of cultures of fear or competition, or just bad leaders. And so the idea is to make sure that we have enough people coming in through that funnel, and when they get into the bucket of our lab medicine profession, that we plug up those holes at the bottom and they can stay within our field, as many of them as possible. And so I think, people like Aaron are doing great work, making sure that they're supporting their schools, doing career ambassador work, making sure people understand and know what our profession is. But it takes all of us. I mean, we can't be behind the scenes and in front at the same time. So that's my spiel.
It does take a village, or it takes an entire lab team to keep it going. But yeah, no, it's with recruitment and training, it's always tough to get more people into the system. So luckily, more people are fighting and kind of advocating for training programs. And at my institution, we're trying to get a lab science training program, but in the meantime, there's local university programs and that need your support to kind of with their students. So if you don't have your own program, be a clinical affiliate and help kind of sustain that, and it gives you on the inside view on that particular aspiring lab scientists, do you want them to join your team? So it's that extended interview process, so you can kind of integrate them and train them in faster. So you're like, what's going to help me with these training programs? And like, it's going to help sustain your team and help your community.
Yeah, and on that vein, I mean, you mentioned DCLS, but I think like PhDs too, and like other non-traditional clinical doctorates. Okay, who take board certification and do the types of things like we as a lab community need to be accepting to that, and also like hear their perspective, because it is a different perspective. And when we're talking about sustainability is resiliency under risk. I mean, that's what it is. And when we talk about new horizons, it's going to take all of our perspectives to think about payment models that work and frameworks like LabCares is an example framework. We're still kicking the tires on that, and trying to see how it works. But we need people to help pilot. We need national benchmarking. You brought up AI, Stephanie. I mean, research implications, it's all huge. And the leaner and smarter we are in the lab, the more room we're going to have to invest in equitable access and novel care pathways. I mean, that's just how it's going to be.
Yeah, I'm glad you brought up resilience too as well. So it's not only building resilience in our newer graduates, our newer people, but also providing opportunities for our existing team members, professional development opportunities, career ladders as well. So giving them the ability to kind of move up and still continually professionally grow and sustain their professional journey by giving them those opportunities.
Yeah. And I mean, creativity is where it's at, right? I mean, we want to look at energy being money, waste is money. And so we've got to consider that as well.
Yeah, value-based success falls apart if we're understaffed. And some laboratories have done a really good job with this, leaning into partnering with human resources departments and getting paid career pathways with specialty certification incentives and advocating for new certifications. But if you think about it, some specialties that involve data research and science, data science, don't even have certifications yet. So when we look into the future and even think about like AI enabled QC review to reduce repetitive review burden, we have to be forward thinking and making sure that we're incorporating those types of tasks and role that will be inevitably a part of our futures into our career paths.
Yeah, and again, from a framework perspective, we're beginning to empower laboratories to define, what are going to be key performance indicators for them, supporting incorporation of diverse institutional experiences, because we want to hear from a myriad of labs. Like, you don't just want an academic perspective, you need a community perspective and a rural health perspective. And that strengthens the foundation for the development of equitable and context-sensitive national quality standards for laboratory medicine, which we haven't really had that to the degree that other specialties have. I think we get bonus points, right, if we can cohesively and succinctly describe the impact of lab medicine and the desired value-based outcome. But that's going to take more pilot studies, more time, and investment.
I did like that, Stephanie, when you mentioned that you brought up HR, that it's good to partner with your human resources group because you have to be able to sustain these initiatives that you want to do. So you need that strong HR partner to kind of help you strategically plan a little bit to ensure that the funds and the framework is there.
Yeah. So lots has been discussed today, definitely more to come. The bottom line is sustainability isn't just a side project, it's how labs will last financially, operationally, and ethically as our healthcare shifts to value.
Yeah, we made it all the way through LabCares. I'm so proud of us, and I'm proud of you for listening. And so I would just like to encourage you, check out the website, labcares.org. Start considering one dashboard metric that you could do, one stewardship work group you could be on, pilot a greener lab process, whatever it is that floats your boat, and then share what you learn, for the rest of us, so we can learn from you.
Mm-hmm.
So if you're doing innovative sustainability work in your lab, we want to hear from you. Let's all be a part of the similar discussion so we can learn from each other and get those best practices cooking and talking and out there in the ether. So drop us a comment, subscribe, review, and stay tuned because the future of value-based care runs through the lab. So until next time, stay SUPERSTAT.